Excellent, great. Well, I want to welcome everyone that's taking the time today to join us for this Telehealth Models of Success webinar. Thank you for taking the time, great turnout. Telehealth is fast moving from a solution for COVID-19 to a key point of access for many Americans. Implementing a strong telehealth program moves your program into a new agile presence in your marketplace. Properly implemented, your program should see no change in the quality of service. Documentation, capture of data, and reimbursements for telehealth services by payers or funding sources. We are excited to offer you this panel presentation scheduled for the next 30 minutes. So the key points that we're going to cover today are these 5 items listed. Highlights of 2 very different models of success, key adoption issues, the team approach, talk about documentation and compliance, and then lessons learned. If we do not answer all your questions that were received prior in chat, and we got a lot, we really appreciate your input, your questions. We also have 2 additional webinars that are going to be scheduled in the next 2 weeks, one on the benefits of Zoom integration in an EHR, and the other one on telehealth reimbursement. So with that, I'd like to start. The last 3 years whirlwind in the industry and adoption of telehealth for mental health care services. There's an overall consensus that we spend too much for healthcare and our outcomes are not as good as other countries. We have to support new care models. Telehealth is certainly one of them. Intuitively, we believe that technology can help grow a strong telehealth program. Having the ability to serve individuals at home, at school, or at their office virtually can expand access and introduce a model of care that you may not have considered to develop or realize that these services are reimbursable. Today's panel offers real life experiences, real success stories that have measurable results. So I'd like to introduce you to our 2 panelists. The first being Michael Corrier. Michael is the CEO and founder of Roadways to Recovery. Michael's organization is based in Indiana and quickly expanding. His approach is being very warmly embraced through many treatment centers, and his staff is growing exponentially. The second panelist is Amy Elliott. Amy is the COO of eHome Counseling Group. eHome Counseling Group is based here in Florida, where AZZLY is based, and is just an incredibly pure telehealth organization that is providing services wildly through corporate America, as well as the VA and many other organizations. So I'm real proud and real pleased that Michael and Amy were able to take the time today to spend with us. So Michael, we'll start with you. Let's address the first 3 key discussion points. Can you please share some highlights of your business model and what makes Roadways to Recovery unique?
Sure. You know, Roadways to Recovery is a unique business model due to the fact that we work with other organizations throughout the ASAM continuum of care through telehealth. Our biggest strength, I think, is that we're blessed with a number of psychiatric and family nurse practitioners, which is a weakness in many organizations due to providers being their highest cost and a limited availability of them. We mitigate the cost by doing the billing ourselves in some categories for these organizations, and by allowing organizations we partner with to use us only on certain days of the week in order to help them mitigate cost, along with an as needed basis with that as well, so that they're not paying a full-time provider all the time when they don't need that much.
Sure.
Our goal is to fill in the gaps along the continuum of care that comes along with, as we are all very well known, is that our healthcare system is very fragmented, and our goal is to come in there and being able to space those gaps that come along with them, and wherever those spaces are throughout them, and we have the experience to go through all levels of it. So we currently work with organizations that are at the 4.0 level, like a psychiatric hospital that we work with. We do all their providing. We have a 3.5 level residential detox that we also work with here in the state. And we also work as a PHP model. We're actually a partner with one of the places here in Indiana that we have a 35-bed facility there that we do. And we also work with them with some IOP. We work with another organization, a couple other organizations that also have IOPs, and we do their medication prescribing for them. And then we also run our own outpatient as well. So we see clients via telehealth throughout the state of Indiana, and we're able to provide therapy services and especially medication management, which is our biggest strength.
Excellent.
We also, go
Hey,
ahead.
Michael, just to interrupt a second, are there any key adoption issues that have to be addressed in your model?
Yeah, anytime that you're doing it, especially going through with different levels of organizations and doing more with telehealth, there's a difference between what it is in person and what it is on telehealth. One thing is having the ability to have a good connection, because you're not coming into the office. So if you don't have a good connection with them and have the set up in a process to do that and do so effectively, you're going to have a lot of frustration that comes through not only with the person on the other end, but your own staff as well. So, being able to make a system that comes in and is easy to use, able to get your consents all signed, keep everything HIPAA compliant and so forth, all those things are slightly, I wouldn't say more difficult, but they're a little different than what a model is just coming in person and signing the forms and seeing them in your office.
Understood. So is there a team approach that you use, and that you're reaching out to other treatment centers throughout Indiana and you're introducing this, or they're approaching you? Do you have to make it a team approach in accomplishing the services that you offer?
Oh yeah, it's definitely a team approach. Any organization that we work with, we want to be collaborative in their team as us being a part of their team as opposed to a separate entity. And not to mention, it takes everybody. It takes a large team to be able to do, your billing, your software companies, your credentialing, all of it's got to work together in order to make it work, so that one, we get paid, and two, clients get the services they need, and they're not frustrated with the billing process as well and getting other charges. So, I think it's something we have to do seamlessly as it comes along, to be a collaborative with any organization that we work with, as well as that we are part of them, as opposed to, hey, this is your separate entity. We want that the clients that come into them to feel that we are part of their organizations, as opposed to two different organizations working.
Oh, excellent. Excellent. Michael, your model right now, you're very focused in Indiana. With your standardizing your practices and best practices that you offer, do you see yourself expanding throughout the United States at any point?
Yeah, we have already had some conversations about how we would look at doing that. Nice thing is we actually have 3 psychiatrists that we use as our collaborators that come through as well. And they are in different states with different licenses. So I know that we're looking at possibly expanding mainly in the Midwest, maybe by the end of the year, going into possibly Kentucky, Ohio, or Illinois. We've looked in all those, and we already have our medical directors are already licensed with those states. So we're just looking for an opportune time and organizations to work with in order to do so.
Excellent. Great, Michael. Thank you so much. Appreciate your sharing that. So Amy, let's move on to you. Same set of questions. Can you please share some highlights of your business model and what makes eHome Counseling Group unique?
Sure. So what makes us very unique is easy. We are 100% virtual and nationwide. So the complexities that go with just those 2 factors make us very unique. The great thing is that we set our goals early and we stay very close to them. Our goals for our company is the quality and caliber of our clinical care and the client experience. And we stay focused on those goals. We never waver from that. There's quite a few things that we do that differentiate us from our competitors. First of all, right off the bat, we've been in business coming right up on 6 years now. So we were and are experts in telemental health long before COVID, long before everybody realized the grace and value of virtual counseling. We've always done it. Some of the ways that we differentiate from to stay true to our goals and to differentiate from our competitors. It all starts with the quality and caliber of our clinical network. Our clinicians are all 1099s across the United States. And we have the highest level and expertise. All of our clinicians are fully licensed and or credentialed in the state or states in which they practice. Our clinicians treat the broad spectrum of mental health condition. That may seem like a no-brainer, but the truth of the matter is as companies are clamoring to get into online mental health care, volume seems to be the focus versus being able to treat the broad spectrum and being able, co-occurring conditions. That makes a big deal. While we are 100% virtual, our sessions are always face-to-face, just like we are today, because we believe that nothing replaces the value of eye contact and body language and verbal and nonverbal cues and being able to see each other's surroundings. Nothing supplants that to build the relationship and the trust that seals the therapeutic alliance. So our sessions are always face-to-face by video. We do almost all, of course you can't do exclusively, but almost all of our sessions are full hour-long 90837s because we believe that's what it takes for a counselor to work with the client and move them through to get better and go off to the life that they want to live. That's very important to us. We have a live client care team. That's certainly the hard way to do it, but we believe that's what our clients deserve. So real live humans are there by phone, by text, by email, to introduce new clients to eHome counseling, explain what we do and how we do it, to help them with all the paperwork and all of that, assessments and everything, get them matched with a counselor and get them in the care of a counselor and stay with them through their journey. So it's real live people here that are connecting with our clients. I think that's a big differentiator for us. And then we are a very, very metrics-based organization. Our owners, Brad Rex and Rogers Curvin, have always known that we can say we're the best, but we have to be able to prove it. So we have an assessment that we have used since almost day one that allows us to have very predictive insights into condition. Our clinicians are able to work with their clients and work through the assessment, talk to them openly about it. We do the exact same assessment at the midpoint of treatment to measure progress. Is this person getting better based on the care that they're getting with our clinicians? And then we do the exact same assessment at the end of treatment to measure outcomes. And that means we can go to insurance companies, self-insured employers, nonprofits, and say, look, de-identified, of course, this is exactly the outcomes that we are seeing for the money you are paying for someone else to get mental health care. So those are really important. I think adoption issues, certainly in the early days, it was just getting people to embrace the concept of virtual care. Mm-hmm. And I found early on, because I am not a licensed mental health counselor, it was surprising to me that the resistance was within the profession. It was counselors saying, oh no, Amy, I'll never do that. It's never going to be right. It's never going to be good as in person. And then COVID came and everybody was forced to find out that when done well, it's incredibly successful. It's great for the clients. The clients feel as though they are in their own safe place when they're taking their counseling. So interestingly enough, COVID helped with the adoption issues. The fact we're constantly watching the client experience, the experience for our clinicians, and the culture that we have a very small but mighty internal team of employees. And of course, we always have to always keep our eye on the ball, our goals for clinical care and the client experience.
Excellent. Amy, thanks for sharing. You really hit on all 3 points. So, interesting what you said about COVID. It actually ended up being a benefit in those that you employ, force them to adopt telehealth. Did you have any were there any challenges that came out of COVID for finding that quality skill set?
Absolutely. I mean, there's no, if we're talking about just the impact of COVID, naturally, every person on this call knows that the demand for mental health care has just skyrocketed. So demand has gone crazy, which is great because we want to help everyone, but it has created a war on talent. So any clinician out there who is good has lots and lots of opportunities. So COVID created a war on talent. What we see is truly, and this, again, we keep our eye on our goals for clinical care, and we find that our retention rate with our clinicians is really, really high. Truth of the matter is, there's been flight. There have been clinicians who leave, and there's, the grass is greener. Somebody else is paying $10 more a session, or doing something a little more attractive to them. What we know is if we keep our eye on the client experience, we keep our eye on the counselor experience, we keep our systems simple. I always tell anybody who wants to listen, for me, clicks matter. In an EHR, on a virtual visit, you have to keep your systems user-friendly for your clinicians. And I'm really happy to say that as we are getting past the worst part of COVID, I'm seeing clinicians come back who realize that the grass isn't always greener, and they like our standards, like how we do business, and they like our systems, so they're coming back.
Excellent, excellent. So, Amy, you touched upon this, and I think the documentation and compliance, the last 2 key points, will just continue roll with you. On documentation compliance, it seems that your care team really has their eye on the ball, and that's where their focus is.
Absolutely. So our client care team is really on the service side, not the clinical side. However, our clinical director, Kate Prendergast, is fabulous. She is a licensed mental health counselor, and she is that direct point of contact, liaison, thought partner, and guide for our clinicians. She does our training. We have created clinical documentation that we have always required, but we keep it simple, we keep it streamlined. We've created notes that have drop-down boxes and check boxes and free-form text fields, so it's easier to create intake notes, treatment plans.
Excellent, excellent. Thank you.
So that's exactly what we do.
All right, excellent. Michael, how about you? Documentation and compliance. How have you tackled that monster?
Well, I think that's a problem with any organization that comes through to tackle that.
Yep.
In person, virtual, whatever, it's always a challenge to make sure that you're always reviewing all your documentation, making sure everybody's doing it compliant wise, et cetera. Part of it is certainly doing your auditing. I don't think telehealth for us is that much different than what we did in person anyway, except, maybe our codes are a little bit different. When we get into telehealth, our notes, you have to mark that you're doing a telehealth visit, where the client is at that time. And, crisis management, you need to know where that's at beforehand, et cetera. So I do think that's a little bit different with telehealth than what we get into normal. But for the most part, the rest of it, other than a little bit of modifier code, and your place of service, for us, it's pretty much the same as doing it in person. But there are some, like I said, some small nuances.
Great, great. Well, we only have 1 or 2 minutes left, and then we want to jump in and tackle some of these questions that have come in. So just the last point, lessons learned. What have you found to be the major challenges in implementing a telehealth? What can someone else avoid?
Ooh, that's a tough one. You want to start, Michael?
Oh, put it on me. All right.
Oh, I have an answer.
You know, a lot of lessons learned, you know, is being able to make it as simple as possible. I think is the biggest thing. You know, there's a lot of individuals that, let's just say that technology is not their best friend and they're scared of it. So I think a lot of things that we come along with is trying to help walk people through it, and when it's something that's scary to them, you know. So some people come in and are like, oh man, we got to do this online. I'm not a computer person. You're like, that's okay. We get you like one link. You just click the link at the time, you know. It's kind of like, you know, getting documentation in. Oh man, that's overwhelming. I got to click on things and go to the website, you know. I'm like, yeah, it's not really that difficult, I promise. Just get there and click through it and you go through it. And we try to make this as simple as we possibly can. And we have people, of course, that they can call and they'll help walk them through some of it, et cetera. So, but yes, I think that's our biggest challenge that has came through with some people with just technology, and they're kind of shy to technology.
There you go. Amy, you got 1 minute.
Well, I will echo what Michael just said and say that, you know, for the clinicians on this call, make yourself an expert on your systems and certainly the virtual visit technology, because you're the first point of contact to troubleshoot if your client is having a hard time getting on.
Great comment. Excellent comment. Well, we all know the latest stats say that there's 153 million people living in areas with high shortages of mental health professionals, making access to service difficult, if not impossible. So telehealth obviously expands a provider's reach. And I thank Amy and Michael for really sharing your time today and sharing your thoughts. I think invaluable, because the more, you know, labor statistics, it's the largest growing market is therapists and counselors. So hopefully you find that quality of counselor, Amy, that you're looking for. And Michael, you're able to bring that level of skill to those treatment centers that don't offer what you have to offer. I think both invaluable. So I thank you both very, very much. I'm going to turn this over to Rebecca, because you've got the list of questions. If I can have you post some questions to Amy and to Michael, please.
Absolutely. So we've had some wonderful questions come through. Here's one for you to start us, Amy. Tell us about that in-person experience and what you have found with clinicians, kind of the training process you got to take them through to get comfortable with the telehealth experience with patients.
Sure, absolutely, because that's a big deal. The other challenge with being 100% virtual and nationwide is we are not in a room with our clinicians. So we're constantly building a network of clinicians, but all of our interaction is virtual. So we have to be very specific and purposeful in our training. We have to be sure that our clinicians know all of our processes and procedures, but also the whys behind it, because that makes a big difference. And keeping systems as easy as possible. Our client care team is great. They provide that same white glove service that our client care team provides our clients. They do the same for clinicians. So we have a lot of infrastructure and resource for helping our clinicians navigate. I mean, and then of course, the other tough side of virtual care is the whole insurance maze if you're in private practice and trying to set up your own credentialing processes.
Did you find that your budgetary allowance for tech had to be different than your traditional in-person models?
Wait, let me get my two bosses on the line here before I say, there's never enough. You know, you have to be sure though, if you are going to be virtual, whether you're doing a hybrid model, both bricks and mortar and combo of virtual, or you're trying to do 100% virtual, you absolutely have to invest in technology, the systems. We're not a technology company. We are a behavioral healthcare company, but we rely on the systems that we use and the platforms that we use to deliver mental health care. You have to have the best vendors. You have to vet carefully. You've got to have people on your team who are experts. And what we see as we are continuing to grow is investing in both technology, but also technology experts. That's where you see the additional spend.
Awesome. So Michael, as a follow-up, now you're the B2B support, right? If I understand it, that you're providing support to clinicians who are providing support to patients. What did you find that you have to do, because you're probably on a different system than your client is on as they serve their patient?
I think maybe what you're saying is some of the organizations we use different EMRs and so forth as we come through. Yes, we do. And part of that is why I go through, because I'm a psych NP myself. So I go through usually and smooth things out and learn it myself before we go on and put anybody else in that position, so that I'm able to be a resource to them and they can get a hold of me whenever they need to, so I can walk them through, do some of the training myself, and smooth out that process with whatever organization we're working with, so that everybody's on the same page.
Awesome. So Amy, back to you. Tell me about, we all experienced a telehealth consult during COVID. All of us called our primary care doctor. All of us probably went into that experience. It's a little bit nerve-wracking, right? For the patient. How do you work through the first-time patient experience? What does it take?
Well, a couple of things. So it starts at the very beginning. So long before they ever meet their clinician for the first time, we provide a lot of education and explaining how it works and making sure that the onboarding process is easy. I know for our clinicians, there's absolutely work to be done for them to make the client comfortable. The whole eye contact. It's a lot of people don't realize that they see the screen, but they're not looking in people's eyes. I always tell clinicians and new employees, test your virtual visit skills. Do it with a sibling. Your brothers and your sisters will be the hardest on you about how you appear on screen. A lot of our clinicians will literally, because the relationship is important, they'll pick up their laptop and just kind of show their client, this is where I work from, this is my office, just to kind of do some of those little things that help the client feel connected, because for virtual care, a lot of it is just truly the connection, making sure people aren't uncomfortable.
Does your team, or have you personally ran a group clinic of any kind in a telehealth scenario?
Yes, we have done, and we do groups. It's tricky. It's more work for the clinician because, I always talk about the clinician having to have command and control, but I mean that in the very most positive way. No clinician who's worth their salt would be just telling their clients what to do. But when I think about command and control, particularly for groups, it's just being able to keep the conversation organized, keep people on task, depending on how large the group is, how many faces appear on the screen. It's a skill to keep people feeling included during the course of the session. And then beyond that, the documentation for group sessions is a little more complicated. You want to have a system that has an easy way to document both individually and for the group. So it's kind of a two-tiered approach to documentation as well.
So Michael, tell us a little bit about that audit factor that you mentioned in making sure that you have clinical oversight over what actually does come in, the quality of what comes in as the output. What percentage do you find that do you find better results or lesser results, or is it about the same with what was in person services?
Yeah, I think it's very similar to what it is in person. We use just like the same type of models as you use in person. We have a clinical supervisor that goes through, and anyone that's under their supervision, they review documentation, they go through and do it virtually on a Zoom call like this or on the phone with them as well, and goes through, and we go through the notes and documentation, what our expectations are, what needs to be documented, and how it's be included. So, anytime we find that, and I do it with some of our own nurse practitioners as well, I go through and read some documentation, and I'm like, hey, we need this included. We also need to add some of this. So it's the same thing as our internal audits as we did in person.
And how do you view the moving from the wrapping up documentation on the clinical side into being able to bill it? Like, what's your experience in how quickly that can happen on average to be able to move it on through the billing system?
Well, we actually use AZZLY for that, and their billing department actually, which is pretty nice, and they do it very quickly. For instance, in Medicaid, we get usually within 30 days we're paid. So it's a pretty seamless process with that. We have our CPT codes are already uploaded in there. We have our defaults and drop downs to be able to put them in, and it's a pretty nice process with that. Actually, with the record, it works well.
Amy, if I can switch to you, tell us a little bit about reimbursement. What have been any of the challenges you've had in getting your payers to accept telehealth consults, and how did you address those? How did you come to the conversation getting those approvals made? Was it a patient by patient basis, or were you able to open entire programs?
It definitely was in the beginning. So pre-COVID, the traditional insurance companies were the biggest barrier, for sure, because they just weren't reimbursing for virtual visits or at a much lower level. We're seeing that get better. On the front end, sometimes verifying eligibility can be tricky because not all of the carriers make it easy to see if virtual visits are covered. And then on the flip side, some of the challenges you see in virtual visits doesn't have anything to do with claims. It's got a little bit more with nobody's walking into our office with a credit card, so collection of copays and deductibles can be a little bit trickier, but we are seeing better acceptance by the traditional carriers. I tell you, we work with a lot of self-insured employers who are much more creative and proactive in their desire to cover at the highest level possible for mental health care. They're not in quite as much of a box as if you're on a traditional insurance plan, but we definitely see it getting better.
And as a final question, either one of you, both of you address, what are the regulatory issues that keep you up at night? What do you have to keep abreast of and ahead of in order to make sure that you're complying with 50 state laws, basically?
So, Michael, I'll jump in on that if you don't mind, and say that for us, one of the things that we have our eye on very closely is the counselor compact, because unlike the medical field in mental health care, the clinician must be licensed state by state and must be licensed in the state in which their client resides. So that is a barrier. The great side of virtual is the clinician. We have clinicians licensed in 4, 5, 6, 7 states, because as long as they're licensed in the state their client resides in, it doesn't matter where they are. But just in terms of demand, it would be a beautiful thing if our clinicians could treat any person who needs their care. That's a really, really tough one. And then we're always looking at, as laws change and guidelines change across the US. But that a lot of that goes back to the quality and care caliber of our clinicians, because they make it their business to know the rules that they have to follow or the guidelines they follow, and we can focus on a more national level.
Got it.
Yeah, I think, it's definitely, ours is very similar to what the clinicians are with the therapist. Ours, we have to get a license in each state. Each one has different requirements. Some of them for our APNs have, some of them need a collaborator, some don't need a collaborator, some of them need, certain requirements to not have a collaborator. And it is definitely a challenge with state by state that you have to go through and honestly read through every law in every state to find out which one is going to be applicable to what you're doing to come through. So it is certainly a challenge, just because most people think, oh, you're in the United States, that's great, but then you have to go through 50 different states to if you're going to work in a different state, you got to find the rules for each one of them, because telehealth is different in other states as it comes through what they're going to allow and not allow. Same thing with licensing, not to mention you got to get credentialed in each state as well. So it definitely has some barriers when you start to cross state lines.
Definitely. We have a team that does credentialing for us because it's complex.
Thank you for your openness. Coletta, back to you.
Thank you, Rebecca. Thank you so much for handling all those questions. There's still many more, and we will answer them and get them out by email to any of the questions in chat or that were received prior. So I want to thank everyone. We're a little bit over time, but I really appreciate everyone's attendance today. I want to remind you that we do have a benefit of Zoom integration webinar coming in next Thursday, and then a telehealth reimbursements webinar coming in the following Thursday on March 23rd. So the 16th and 23rd. A special thank you to Amy and Michael for taking the time out today, and also to all the attendees. We really appreciate you joining us today. We hope that you found benefit. Thank you and have a great Thursday.
Thank you, Coletta.
Thank you, Coletta.
Bye-bye.